And then after that, I got to say, one of the things is in the background, this government has inherited, the current government has inherited a lot of neglect on planning around workforce and a lot of neglect around planning on capacity for our acute care hospitals, how many hospital beds are we going to have per capita, but also our long-term care and continuing care. And a lot of that stuff got neglected to the point where now in the last 2-3 years, getting harder and harder to get people in the system. I'll always say it because I'll probably talk about a lot of negative things here. Right, I'll say off the get-go, if you can get into a system, you get some of the best care in the world. Still get it. It's the getting in that's really hard. And fast forward to what really changed a lot in the last couple of years is got a new government in, inherited a lot of problems, but this government actively dismantled our provincial healthcare system and made a bunch of changes and broke it up into 4 silos. We got 4 ministers now. There's acute care, there's long-term care, there's Recovery Alberta and mental health, and then there's primary care. 4 new ministers, 4 new CEOs, 4 new administrations. Actually, it's 11 CEOs because they forgot about cancer care and public health and you name it, all that. They really broke it up and separated it to the point where we come to here now, been advocating really hard for the last couple of years. Let's improve the foundation of primary care, get everybody, family doc, work on that. But also said at the same time in 2023, gave them a plan and saying, hey, we have to do some serious stuff on our acute care hospitals to make sure they're functioning, make sure that we can do safe and timely care for all Albertans when they get sick. And sadly, government didn't move on that and didn't work on it and kind of just kept going on breaking up the system and reorganizing it to the point where in the last year, we've been redlining. So anybody out there that hears that this is just influenza and that this is just a little blip because of influenza, I'll just tell you, influenza is probably like 1,000-pound brick that landed on the broken camel's back already because we were really struggling for the last year and really begging the government saying, listen, we need some kind of organized provincial control of this and really start focusing on things. And then we got slammed by the increased volumes in respiratory illnesses that we knew were coming. We knew this was coming. I mean, we saw, everyone should understand that we see the influenza hit in the southern hemisphere in the summer when it's our summer, their winter. And we knew this was going to be bad and we begged them for help. And then sadly, it just got to the point where we really got to the point in Edmonton, for example, where if you think about it, let's simplify numbers. At one point, Edmonton has 275 emerged beds in care spaces where they can take care of sick people. In December and into now even, there were times where there were admitted patients. So sick patients with strokes, cancer, broken bones, you name it, surgical emergencies, heart attacks, stuck in the emerge. They were 250 of our emerge beds were for patients that should have been up on the wards, taken care of by specialty teams. But the wards are overflowing. The wards were having rooms where there was, if a room was designed for 2 people, it's got 4 in it. If it's, we literally have patients stuffed in cubby holes up on the floors, where I'm not even making this up. I'll tell you, we have patients in some rooms where there's no call bell and they have it like a ding ding old fashioned bell to try to get the nurses. Yeah. So we got to that point where there was just no more give. And if you think about that, just think Edmonton's own probably didn't, even 270 beds is not quite enough to take care of all of the emerged patients for Edmonton and everybody coming into from Red Deer North all the way to the Northwest Territories, and 250 of them are taken and gone. Right, you're operating like an entire, 2.5 million people plus more area out of 20-30 emerged beds, and that's where we get to. My colleagues across the province have been saying it's not just Edmonton, Calgary. I just got off the phone with colleagues there. Never seen it this bad. Never seen it this overcrowded. And what that turns out to be for everybody to understand why we're talking about it, why we're saying there's a lot of semantics around declaring a state of emergency, for example. We're not saying you got to bring in the National Guard and the feds and the Army and or implement pandemic measures where you can't go out and do things like. We're not saying that. We're saying we're in a state of crisis and an emergency or a disaster where we need provincial control and we need coordination. And there's lots of things that we can do. But we need to make sure, we just got to kind of define it. Say, yes, it is a state of crisis. Yes, we are having trouble. And then we need to say, who's going to kind of come, if you think about it in a disaster, if a plane crashes, anything happens that's big, multi-casualty, you define one person. You're the leader. You're going to get your team around. You're going to control this. You're going to actually make sure you're empowered and resourced to take care of it. And then you're going to kind of mitigate, and do the best you can. We haven't declared that in the province. We haven't got any one leader. We haven't got the government saying, yeah, it's real. and here's how we're going to get out of it. So that was a long answer to say, 15 odd years of, we made some improvements, we got better. The last couple of years, I got to admit, it's been the hardest any of us have ever seen in the last little bit.